Hello, everybody. My name is Haley Sadler.
And my name is Maya Brooks, and our project is about Valium.
Valium, also known as diazepam, is a benzodiazepine drug. Common names of this drug include benzodiazepine, and Valium. Each of these drugs fall under a drug category that works as an analytic and sedative. This drug is commonly used to treat many different areas, including seizures, muscle spasms and twitches, and even anxiety. In some cases, it can be used to reduce the side effects of alcohol withdrawal. We will be focusing mainly on the clinical use of Valium. The history behind Valium. In 1959, the drug was first synthesized, and in 1963, it had finally entered the market after further testing and development of the drug. Between the years of 1968 and 1982, it was the top-selling drug on the market, and in 1985, different brands of Valium were sold, taking a different name. In New Jersey, the first benzodiazepine and another drug, also known as Librium, was discovered accidentally by Leo Sternbach in 1955. Following this was the development of Valium. Valium was not extracted from a plant, but synthesized in a lab in 1959. Valium quickly gained popularity because it was a safe and effective drug, but with that, worries of overuse and abuse increased. Valium has a half-life of up to 24 to 48 hours. It can take up to 10 whole days to completely leave your system. The drug is metabolized in your liver by enzymes within the CYP450 system. The main form of excretion for Valium can be seen mostly in the urine. We cannot be sure whether depot binding affects the bioavailability of Valium. Some of the administration routes for Valium include intramuscular, which is administered, should be avoided due to the slow onset and irregular absorption. Suppository, which is inserted into the rectum. This type of administration for Valium is fast and very effective, but it is not available in the US to take rectally, but it is available in other countries. This takes 10 to 45 minutes for the peak levels to be reached if administered. Orally, Valium will be absorbed through the gastrointestinal tract. Absorption can be delayed and disrupted if it is administered with a meal. If taken correctly without a meal, it should take around 30 to 90 minutes for peak levels to be reached, resulting in a very fast onset and absorbed very quickly. Some of the behavioral changes and effects we can see. Long-term abuse of this drug can cause symptoms such as dizziness, sleeping problems, and impairments. With the long-term abuse of this drug can increase the risk of dementia, which is irreversible. Mood changes that can occur with the heavy use of Valium is aggression, agitation, depression, anxiety, and irritability. Some of the cognitive changes that might occur if this drug is used for a long period of time is your processing speed, memory, executive function, and the sustained attention can all be affected. Based off long-term Valium users, 20.7% could be classified as cognitively impaired because of the use of this drug.
So this drug primarily shows super obvious action on the vigmental area. So when GABA bonds to like a GABA receptor, like GABA A, chloride channels will open and then the chloride will enter the cell, and this would cause membrane hyperpolarization. However, part of the GABA alpha receptor is that when GABA and any benzodiazepine interact with it, it has a different effect, and the receptor changes shape to better bind GABA, increasing the levels of it that ultimately end up passing through it. And so all of the symptoms that users experience when taking Valium can be explained by their biological like happenings. So the acute symptoms of taking Valium and having it impact that receptor are just simple things like dizziness, drowsiness, relaxation, memory loss, and like slurred speech. And that's happening because the hyperpolarization of the cells is just relaxing everything. And then if you use it for more of a long-term situation, eventually you'll end up tolerating it to the point where you need more and more drug to get the same like quote unquote high. And the symptoms of long-term users who are at this state is like hallucinations, fatigue, anxiety, depression. They're not really feeling great. So, and there's a separate part of this because it does go down the mesolimbic pathway, the dopamine mesolimbic pathway. You will also see like increased cravings and like panic attacks and agitation. And the body of those who use Valium frequently eventually adapts to a dose, and they're going to need to take more to actually get it to work. Although Valium in the VTA has an inhibitory effect on dopamine levels, it ultimately causes like a kind of signal cascade to the nucleus accumbens to make sure there's more dopamine there, and it goes through the mesolimbic pathway. And so obviously with something that goes down the mesolimbic pathway with dopamine is going to have very, very addictive qualities. And if you try to stop it, you'll have all those withdrawals. And these are the citations we used.
Thank you.
Thank you very much.